Hi, I'm Kathy Cassidy. I'm a clinical forensic therapist, and today's video is going to be about symptoms of sexual abuse in toddlers, say around age 2 up until about age 6. Nothing is a science as far as symptoms, and I always want to preface that in every video that if you see any of the things that I'm talking about today, it does not mean to call 911. So the symptoms that you might see in a toddler to about age 6 would be a lot of like tantrums and crying. That isn't their normal behavior. Bedwetting after they've been potty trained, nightmares, waking up in the middle of the night crying, wanting to maybe sleep with you. The other thing that you would see is the rash in the genital area. You might smell a foul odor, and that would go for all ages as well. If your child has discharge, blood, infections such as bladder infections, yeast infections. Some of those can be medical reasons. Always go to your pediatrician. You may need to go to the emergency room. Use your best judgment. The other thing that you could see that's a little different in this age group is the kids can start acting out sexually. So sometimes kids who've been sexually abused will tend to become sexualized themselves. So you might see your son or daughter trying to do sexual things with you or their babysitter or their sibling. Yes, there is a normal age of sexual curiosity around the age of 5, even in early toddlerhood where they start touching their genitalia. But I'm not talking about average milestones. What's going to stand out to you is that it's like a constant masturbation, say at age 3, where they're constantly doing it. So things that become sexualized, asking sexual questions in a non-normal developmental way, which would mean like asking about pornography or saying someone showed them something that's sexual. Those are the things you want to watch for. I had known of a child who would try to wrap her legs around this man who wasn't her family. She was, I think, 4 years old. Her vagina was in his face. That was very odd behavior for a child. If your child is behaving in that way, again, always as a parent, you're looking at the big picture, the whole picture. They're acting that way and now they have a new babysitter, or the neighbor's been watching them, or they've been having sleepovers with their cousin. Can be the same gender, can be female to female, male to male. There's no boundary as far as who can offend your child, which is very frightening. It's important that you're aware of it. Just because they're the same age, just because they're a couple years apart, doesn't mean that it's not happening. Be aware, and I don't mean checking like a detective, but you do want to be aware of their underpants. When you're doing their laundry, if you see blood, you see discharge, you see stuff that just isn't normal, or you have a weird feeling about it, you need to go to the pediatrician. Let them know what your concerns are. Make sure, is it a medical issue? Still keeping an eye out, remembering who's around them. Nobody in their life is exempt from hurting them sexually. It's a sad truth. Just because it's your mom, your dad, your uncle, your sister, nobody gets carte blanche to be trusted. We can only do so much, but there's a lot we can do. So that wraps up our video for today. If you have any questions or comments, please respectfully put them below and I'll do my best to address them as soon as possible. Thank you guys. Bye.